Using the health transit model to affect social determinants of health through a neurodiversity inclusion initiative. Hello, and thank you for watching. I'm Allyson Goodwin. I'm a specialist professor at Monmouth University in the Occupational Therapy Department. I have short black curly hair and I'm wearing a white shirt with a navy cardigan. Juliana Nichols contributed to this project. She's a graduate assistant in the Monmouth University Occupational Therapy Department. She has very long medium brown hair and is wearing a navy sweatshirt. I'm going to speak today about the general what and why of the project, give an overview of the health and transit model concept, go over the objectives of the Neurodiversity Inclusion Project, and then talk about some successes and challenges. The Neurodiversity Inclusion Initiative at Monmouth University is a program designed to support neurodiverse students by addressing their social, academic, and health-related needs through the health transit system model. The reason this is necessary is because specific students have neurological processing that places them well outside of society's norms, and the systems for social support may not yet allow access to individuals who process out of what is deemed normal. The research shows that students who process information differently, or neurodivergent students, have limited access to student support services that represent specific means to improve health and connectedness to their communities. The Neurodiversity Inclusion Initiative is meant to develop the ecosystem of support services for neurodivergent college students to improve their access to systems of support. The model we're using to develop the ecosystem supports is called the Health Transit Model. The Health Transit Model imagines the ecosystem of student support as a transit map. At the center of the map is a transit hub, which represents an entry point to the health transit system. At the transit hub, an individual would need to complete screening or assessment to decide their direction of travel. The 5 lines of travel along the health transit map represent the 5 categories of interventions for social determinants of health created by the United States Department of Health and Human Services. They are education access and quality, healthcare access and quality, neighborhood and built environment, social and community context, and economic stability. Along each one of these lines of travel, there are 3 stops. The first stop represents the transaction between an individual and a navigator that helps to refer, based on screening at the hub, to specific services to meet their needs. The second stop is participation in community resources. The third stop on the health transit system is advocacy, which represents increasing resources through activism, awareness, and policy. Based on the health transit model, the Monmouth University Neurodiversity Inclusion Initiative created the following objectives to better build out the ecosystem of support for neurodivergent learners. The first objective is to develop a neurodiversity inclusive assessment tool that serves as a transit hub for neurodivergent individuals. The second objective is a personalized transit map that may more clearly meet the needs of neurodivergent individuals within student support services. The third objective is to facilitate referrals and connections through a disability-forward student organization for neurodiversity support. The fourth objective is to collaborate and partner with existing services to ensure access. And the fifth objective is to standardize the system and apply its successes to other communities in higher education and beyond. There have been some successes in the project thus far. The first success is the translation of the health transit model into an ecosystem needs assessment. The second success is that the administration at Monmouth University supports resources for faculty development. The provost sponsored a grant for faculty assessment and initial training. The third success is a very high level of interest from faculty. Out of 307 full-time faculty members, 38 participated in the initial needs assessment for attitudes for inclusion of faculty toward neurodivergent students and the first training session for neurodiversity inclusivity. The project has not been without its challenges. The speed of change is very slow in a complex system. It's hard to determine a timeline based on the amount of time between initial contact and the completion of a small step in the process. The second challenge is that student support services have a generalist approach, and it can be difficult to develop alternative access systems for neurodivergent individuals. A third challenge is finding a way to make big impacts to first-year neurodivergent students that might not have academic supports identified. Students that don't have identified academic supports may not yet identify as neurodivergent and also may not yet know how to meet their own social support needs based on what is available within the system. Thank you very much for taking the time to listen to this presentation.